So what if I told you there's an invisible monster around wreaking havoc on communities around the world? Every day, MRSA causes severe infections that are very difficult to treat with medications. Per the Infectious Society Disease of America, MRSA is a significant cause of healthcare-associated diseases and community-associated diseases. The CDC states 2 in every 100 people have this strain of bacteria, MRSA. During my speech, I'm going to cover why it's important for you to know about MRSA, how people get MRSA, what it does to your body, and treatment and preventions of MRSA infections. Has anybody heard of MRSA before?
Yes.
Why is it important for you to be aware of MRSA? Well, according to the Center for Biotechnology, Staphylococcus aureus, which is the SA part of MRSA, is an opportunistic infection, opportunistic pathogen, which means it basically takes advantage of a decreased immune system, or say you have a cut in your skin, it takes advantage of that pathway, like that cut, to infect you. A little bit of background about MRSA. It was first identified in 1950. For about 20 years, it was treated with penicillin and derivatives of penicillin, which were really effective forms of treatment. And about 1970, a new strain of Staphylococcus aureus, which is the SA part, was identified as being resistant to the penicillin and the derivatives. So since about 1970, the MRSA has been around and been showing up in communities and acute care settings around the world. How do bacteria become resistant to antibiotics? Well, there's 5 main mechanisms for bacteria to become resistant, but we'll focus on the one that has to do with MRSA. Basically, the Staphylococcus aureus creates an enzyme that inactivates the penicillin and the derivatives, which are the medications that we originally treated it with. So in layman's terms, think about it as a vehicle being the antibiotic and this building being the bacteria. And you need a key to start the car to drive into the building to treat the bacteria, but the bacteria hides the key so the car can't drive into the building to treat the infection. So that's basically what it does. It inhibits the antibiotic from getting to where it needs to go. Now that we've established a solid foundation of what MRSA is, what does it do to the body? And how do people get it? According to WebMD, MRSA is contracted from touch, whether it be person to person or person to surface. So say someone with MRSA touched that table before you sat down, you can now have the MRSA bacteria, and then it can now infect your skin. Also, according to WebMD, 2% of the population have this bacteria, this resistant strain of bacteria. A little short side story. I'm a nurse in a hospital, and I started nursing about 2 years ago. My first week off orientation, I had a patient with a MRSA infection, and like I stated, it's a contact-to-contact contraction mechanism. So when patients are in the hospital and they have MRSA, we have them on contact precautions. So they have to stay in the room, and when anybody goes in, you have to gown up and put gloves on, the whole 9 yards. So I was a little sidetracked, trying to make sure I got all my ducks in a row, my medications are given, my documentation's done, and I let the patient walk out of the room and down the hallway. So my charge nurse immediately sees it, and I was like, "What the heck are you doing?" I'm potentially contaminating the hallway, the floor. I mean, it's a big deal in the healthcare field, in that environment, because that's how healthcare-associated MRSA infections happen, by not being prevalent and strict precautions and procedures. Some symptoms of MRSA infections. Healthcare-associated MRSA infections can cause some really serious infections and problems with the body, like pneumonia, which is an infection in your lungs, or sepsis, which is an infection in your blood. If you just think about that for a minute, bacteria in your blood goes everywhere. I mean, it perfuses your brain, it goes to your kidneys, your liver, all these really essential organs, even your heart, and that can potentially give you an infection in your heart or anywhere that your blood goes. Also, some bone infections are more common, or UTIs, and this is all per Healthline. Also per Healthline, some symptoms include swelling from a site of injury or drainage from a wound, or heat from the wound, or generalized temperature or sweating. And now to what are, in my opinion, the two most important topics regarding MRSA. And this is the treatment and prevention. According to the Mayo Clinic, there's various medications that we use to treat this resistant strain of Staphylococcus aureus, MRSA. More times than not, it's all these antibiotics, but they're usually incorporated with a medication called vancomycin. Vancomycin is a medication we give intravenously, and it's a medication that we have to titrate, which means adjust the dose every day according to the concentration of the patient's bloodstream, because it's a really potent drug and it really needs to be at a certain level to be effective. And oftentimes patients' kidney function and other function of their body starts to slow down because of the toxicity of all these drugs. So that prolongs the treatment because we have to lower the dose of the medication. So, I mean, that's a very common complication of healthcare fields. And that again is per the Mayo Clinic. The Mayo Clinic also states that the best defense against germs is hand washing. Something so simple can prevent something so serious such as sepsis, bacteria in your blood. They recommend you wash your hands for at least 15 seconds. And they also recommend keeping your personal items personal, like your comb or a towel or your purse, even your phone, because again, it's touch to touch or touch the surface. In closing, methicillin-resistant Staphylococcus aureus has the potential to cause some serious harm to the body. If you take anything away from this speech, remember that prevention is key. Something so simple as washing your hands for 15 seconds could prevent the contraction and the spread of a really serious and potentially deadly bacteria. Thank you so much for your time. Oh, I need some water.
Do you guys have any comments or questions on Chandler's critique?
I just wanted to say that we test all the babies 48 hours after they come in, and then again in 2 weeks we test their nose and their armpit and the rectum for MRSA.
Yeah, that's one of the most common things is nares.
We see it a lot of times in eye infections too, and once they're diagnosed, like you said, total isolation from that time till they go home.
And even when they come back, we have a book that says, they had MRSA the last time, even though we cured that infection, but because they had that resistant strand, we still have to keep everybody safe. And even as a healthcare provider, we have to prevent, us from spreading it,
Okay, 2 questions.
Yeah.
The first one is you stress a lot about, contamination and kind of like quarantining. Is this something that someone has to live with the rest of their life, or can it be cured?
MRSA, you can, as far as a wound, say you have a wound infection, we can cure that, or get rid of that bacteria. But studies say that you still have that strand because it's not always isolated to that one spot. It can get in your blood and not show up in blood tests, but then you all of a sudden get a cut over here, and now you have this bad infection. So we can cure a MRSA infection, but as far as getting rid of it once you've contracted that strain, it's really hard to say because it can become resistant again.
Right. And the second part of that was
Just remember those 5 mechanisms.
Right. Well, as far as kind of keeping it quarantined and informing people, it says that there's only 2% of the general population has it.
Like 200 people.
Has there been any widespread cases of it spreading?
When I was on the Center for Disease Control, they didn't say there was. I didn't see any articles about outbreaks, but I'm sure there are.
Okay.
In hospital settings, like when I was a new nurse and I let that patient walk down the hall, stuff like that happens all the time, I'm sure.
Yeah.
I'm sure there's cases where a bunch of people end up having it in one isolated spot. But it has to be a huge outbreak for the CDC to report it.
Right.
Are there any other questions or comments or suggestions you'd like to offer? Great.